major is really about taking the disciplines of the humanities and the skills you learn in the humanities, so English, history, philosophy, ethics, music, fine arts, and saying how can we use those skills to improve healthcare and healthcare outcomes. And we're saying if you can learn really good critical thinking skills, analytical reasoning, empathetic reasoning in all these great classes, why not use them to improve healthcare? And so our students are asked to really tackle big questions in healthcare. We ask them to think about what is disease? How is disease constructed by different groups? And what does it mean for a physician to construct disease versus a patient to construct their experience of that disease versus society's expectations of what that disease should look like? What does it mean to look at medicine as a culture and to understand that you can have cultures that collide and what happens when two cultures collide? So the students are really asked to think critically about, our healthcare system, and the outcome really is we're creating agents of change. The idea is that they're going to go out and they're going to say, hey, the system's not terrible, but it could be a lot better, and here's how we can improve it because we've gotten the skills to do that. If you're interested in this degree, you can do literally anything that has to deal with health and medicine. But we have students who use it as a pre-med degree. In fact, humanities majors have a higher acceptance rate for medical schools than what's considered the traditional majors, the natural sciences. So if you want to go to medical school, we have courses on medical ethics, narrative medicine, health disparities that are going to prepare you when you go into that classroom. You're going to know what they're talking about, right, from the very beginning. If you want to go into healthcare ethics, we have a student who's studying a PhD in healthcare ethics right now, and what they're reading in their PhD program is what we taught them in his undergrad. Which is extraordinary. He actually read a professor's article from Misericordia for one of his classes. If you want to go into healthcare policy, public health, health education, these are all options. So really it prepares you for anything that relates to health and medicine because we're thinking about how the program gives you these fundamental skills to be critical thinkers of how the healthcare system works. But also it allows students to sort of cater their major. They almost have what I'd say concentrations within the degree. So if you're interested in disability studies, you can focus your courses, your course selection on disability studies. If you're interested in healthcare policy and politics, you can focus your degree on that. If you're interested in public health, we have a number of courses that are pretty much straight up public health courses, but with a humanities twist to it that really emphasizes the person that's involved in the healthcare decisions. The students I want in our program are the students who want to make a difference. The students who feel like I have more to give. They're students who want to give. They're students who see that there are injustices, there's inequalities, and they're tied to health because health is something that's with us all the time. We can't escape it. And to recognize those inequalities and to want to make a difference, I want the students who come in fired up to say, teach me more so I can do more. And I think that's the students we attract. We have students who are going off and they want to change what they see as unfair. And I cannot be more proud of my students when I see that. So that's the type of students we tend to attract, and that's the students who come to our program. And come to medical and health humanities because they're students who say, I want to be in the healthcare system, but I don't want to be complicit in the things that I think are wrong with the healthcare system. I want to make it better. Misericordia, I've been here in my 11th year, and I came here because people tell this story, when you get on campus, you have a feeling. I know it sounds a little bit cheesy, but you do. You have a feeling and it feels like home. And I think what's amazing about Misericordia is the spirit of Catherine McCauley and the Sisters of Mercy, because they're not complicit. They've never been complicit. They've always wanted to do better and to really address those injustices and be agents of change. And so I think you come to Misericordia because you want to be part of that legacy and that history. You want to be the change makers. Our students are scholar activists. They're scholars, they learn, but they're activists and they're going out and changing the world. And that's what we're looking for. The faculty for the program come from across the university. I think that's what makes our program unique, is it's interdisciplinary. So you're going to have classes taught by English professors, historians, philosophers, fine arts professors, but you're also going to have social workers, occupational therapists, and nurses teaching you, because this is really about team-based healthcare. And we even have courses that are team taught. So you're going to go into a classroom and this semester I'm teaching a class on health disparities with a social worker. And our perspectives are very different sometimes, and that's a good, healthy discussion. She has a lived experience, I have sort of an academic experience in looking at health disparities, and this really gives students the opportunity to see how we work together and how these disciplines are not in conflict. They're actually very complementary. They can work together to do good things. I would encourage any prospective student that, reach out, even if you're not sure what you want to do, if you're not sure that this degree is for you. What I love about MHH, it's a degree for almost anyone, and it allows you to pivot. I think back at 18, at 17, it's really hard to know what you want to do for the rest of your life. And we know people change jobs, I think it's 5 or 6 times on average in their career. I didn't know at 17 or 18. I think I wanted to be a Supreme Court justice, to be honest. What MHH allows you to do is you get the training that you may go into one profession for 10 years, but you have that degree that allows you to pivot to another career related to health and medicine. So I would say if you have any interest at all in this very broad idea, come talk to us, ask the faculty, ask questions. We can put you in contact with alums and they can tell you where they've gone to and why it's an important degree for what they've done. But I think, if you have that broad interest, it allows you to pursue any number of different careers in the future.
I was really just looking around at different programs at the time. Being a sports guy, I really wanted to be an athletic trainer, and I saw the PT program here and I was like really drawn to it. But then I found the MHH program, and I always wanted to do something health related and I never really knew what. And MHH kind of just fit because, it gave enough opportunity to go in any direction I wanted. So, I was drawn by the PT, but then once I found MHH, I'm like, I think this is definitely the way to go. I think I knew it was Misericordia from the beginning. I mean, there's a few other schools, but, once I saw, looking at the program and the environment, the school, I'm like, there's no other place that really compares. So it was really just Misericordia from the beginning. I really appreciate the small campus and how close the environment is. So as soon as I saw the campus and how close everything together was and close knitted everyone was, I think it was my tour guide saying hi to everyone, and it was just this nice interaction with everybody. I'm like, that's the kind of school I want to go to. I don't want to be on this giant campus where I have to go 20 minutes to a whole new place to get to class and I don't know half the people I'm seeing. I really appreciated coming from a large high school, coming to a little bit smaller university where I can really know people who I'm around. What I like a lot about MHH is that it covers such a broad amount of material within the program. It's not, just focusing on one topic and really looking at just one thing. It's covering so many different aspects. So in my 3 years, I've looked at public health, doctor-patient relationships, history of medicine, and different examples of relationships over time. I've looked at health disparities and looking at that even more right now. And each one of those things has found a different way to interest me, and I think I've grown more as a result of having all these different insights. My favorite class I've taken so far, I took last year, it was philosophy of medicine. It's kind of a nice intersection because I'm both a medical and health humanities major and a philosophy minor. So it was kind of a nice intersection between those two ideologies where I could look at how medicine and how we address the body and patients, but also from a more philosophic standpoint, looking at older philosophic texts to kind of back that up. It was a really, really interesting time. The faculty here at Misericordia are very unique in that you can really talk to any of them. I have great conversations with faculty here all the time, and it will be over something completely random, or I might just stop by their office and it turns into a 1 or 2 hour discussion. And I don't feel like you get that many places. And that's what really makes our faculty really great here, is because they want to have that kind of interaction and they're there for you to do that. And I feel like that's something you're just not going to get a lot of places besides Misericordia. I've lived on campus since freshman year and I've loved it. For the past 2 years, I've actually been a resident assistant on campus, or I guess community assistant it will be next year. It's a great environment, I feel like between all the floors and the buildings, it's a very close-knitted group, and by the first, second week, especially freshman year, I knew everyone on my floor, and it was just like we were all one big family, and it's so much fun, especially with programs and stuff happening all the time. I love living on campus, and I don't think I'd give that up just for the experience purpose. I'm on the track and field team and on the esports team as well. My coaches, regardless of what sport I was involved with, were focused first on academics. It wasn't worrying about whether how much you were there, what you're doing. It was academics before anything. So as an athlete, having my coaches actually concerned with the classes I'm taking, how I'm doing, constantly asking and checking, that really made me feel better. And then the professors that I've had have also worked really well to make sure that I can balance both. It wasn't, you're gonna have this done regardless. It was, you might need an extra day because you have this big meet. That's understandable. And I've had a lot of help on both sides, making sure I can get everything done as both an athlete and an academic. Don't be too worried, don't be too nervous. You got a great future going for you, and I'm only 3 years ahead of myself right there, but I can already tell you got a lot going for you. You just keep it up, keep talking to people, and just keep your head up, keep pushing through, because you might be a senior in high school, but real soon you're going to be getting through college and having a great time, meeting tons of new people.
I am a medical and health humanities major, and I declared a second major in psychology my sophomore year, and also a minor in ethics at the same time. I'm going to apply to grad schools for a master's in public health. I want to be an epidemiologist, so I want to get into a good program that has a pretty good epi program. All the professors here are always so helpful. They're so willing to accommodate for you, and if you need help, they're always willing to go the extra mile for you. Whether that's shifting their office hours a little bit so that they have time to see you that works with your schedule, or anything like that. I think every professor I've had, Dr. Caleb is my professor and my advisor. It's been so nice, and I also like that MHH has such a wide variety of professors that are experts in different things. That really helps a lot with getting different perspectives on different things, and I think that's just all helped in itself in the classroom. And that's one thing I really love about MHH. I've developed my beliefs, my opinions, my values, my morals so much over these past 4 years, and I didn't have much coming in that I had established, but with their help and their knowledge, and it's really helped to shape me and help me figure out who I am and what I stand for. And I don't think I would be where I am now without all of my professors and Dr. Caleb for helping me with everything as my advisor. There's so much knowledge in so many different areas, and I think that's such an advantage to have because not everyone has that. You take someone with one major, they're getting one perspective from experts that are just professionals probably in that one field, whereas the MHH department is composed of people from philosophy, history, fine arts, English, so many different areas. It's great because you also get the more English centered. Dr. Caleb is really into the writing papers, and she's a tough grader on papers, but you need that. Whereas if you're with a history professor, they might be more interested in the historical context that you're providing in your paper. Whereas if you're with a fine arts professor, they might take a whole different approach. They might not even have you writing really papers, but it might be a different atmosphere. Philosophy for me was a lot of class discussions, and psychology is a lot of, this is this and how do you apply it to the situation. So I don't know, I think just having that broad range of knowledge and getting advice and honing in on different things with different professors, it prepares you. It gives you more of a well-rounded educational experience that not everyone gets if you're just in one straightforward major that focuses on this, and this. Whereas MHH kind of covers everything. So I'm an intern with the Cougar Care team at Misericordia, basically the COVID protocol update management team on campus. As an intern, we do a lot of the stuff you don't see, but kind of the behind the scenes work. You know, we're talking to students who are in quarantine and isolation, you know, kind of giving them guidance and advice and, you know, talking to them every day. But also recently we've been involved more with the data and the tracking and all of that, you know, kind of making sure everything is in line, but also, you know, providing the university with a student's perspective on everything going on. So, you know, we hear a bunch of students talking about this concern or that concern. We're those people that have to bring it up to the higher ups so that something happens. So, you know, I really like being that person because I can kind of focus in on like people my age and what we're really concerned about. Whereas people more administrative, on the administrative side, they're not seeing all of that. You know, they might not be with students every day. They might not really know how we're feeling or how things are being portrayed and how it's coming across. So providing them with that perspective is also great. We also had to take the Johns Hopkins contact tracing course, which was an online free course, but that actually provided me with so much knowledge about COVID, learning like the ins and outs of COVID and transmission and everything like that, and kind of what's gone into the protocols that the school has, and why we have the rules that we have on this campus, and being able to, you know, effectively communicate that to like my friends and my family, and you know, like ensuring them that, you know, the appropriate measures are being taken, and you know, we consider those every day. We're like, do changes need to be made here, and we go through every little piece of it. You know, I think it's just been a great experience to be involved in kind of public health at a university-wide level, because you know, that's ultimately what I want to do for a larger group. But it's been like a great introduction. I've learned so much and kind of what it involves. You know, all the different aspects that, you know, come together and make a functioning unit that, you know, is going to help everybody. I think really doing your research and finding something that you think you might be interested in is a good place to start. You know, seeing what you're passionate about, really trying to figure that out, but that also might not come until you're in college. And I mean, definitely reaching out, getting a good idea of, you know, maybe things you're interested in, but also not being afraid to branch out, but also, you know, doing your research, finding information that you think will help you in the long run, and you know, always just keeping an open mind and you know, taking all the opportunities that come your way. As a prospective student, it's so important to get that on-campus experience, really figure out if Misericordia is the environment for you. I'd highly suggest that you come take a visit to Misericordia, meet the professors in the department that you're interested in studying with. You know, if you have questions, ask away. There's no stupid questions. Every question's important. You know, just take advantage of all that Misericordia has to offer on your visit. And yeah, I think you'll know right away if it's the spot for you. I think the atmosphere here is so different. It's so unique. It's so tight-knit, and it's unlike any other campus I visited. So I think you'll know right away if this is a choice for you, and if it is, then congratulations. And I'm excited for you to start your journey.